online right now. Okay, so I hope everyone can hear me. My name is Lasita. I'm a fifth-year medical student currently studying medicine at KDU, and I'm going to be finishing very soon. So this is regarding intake 43. So the people that are going to be starting, the medical students that are going to be starting next year in January of 2026. So this is a video for all of those people who are interested to study medicine at KDU. So I'm going to be talking to you guys about the entry requirements, how to apply to study medicine at KDU. So everything that I'm going to be mentioning today in this video is mentioned in the KDU website. So you can go to the website itself and look at all this information over there. But I'm going to be talking to you about this information myself, and if there's anything extra that I would like to add, I'm going to do so, because there are a lot of you that keep asking questions that go beyond what's in the website. So I'll try to explain a little bit more about those things as well. So first of all, I would like to say the deadline for application is coming very soon. It's going to be on the 18th of July. So just a few days away. So make sure to apply as soon as possible if you're interested to study medicine at KDU. And with that said, let's go with the most important informations that you should know, the common requirements to study medicine at KDU, or at least to apply to study medicine. And that's that you have to be a citizen of Sri Lanka, and you have to be between the age of 16 to 24. That's only if you're a student coming fresh from A-levels. If you set your A-levels in last year 2024, then you have to be between the age of 16 to 24. If you're someone who has done a biomedical science degree, for instance, a BSc degree beforehand, then you can apply up to the age of 27. So obviously that depends only if you have done a degree previously. So with that said, GCC's, GCE examinations that you're going to be doing should have been done in 2024, and that should give you the eligibility to apply even for a government university. And the results should be achieved in the same sitting, and obviously you have a maximum of 3 attempts. So that's the usual 3 tries that you get. So within those 3 attempts, you should have passed your A-levels. And a common question that I get asked here is whether you can combine grades from your previous tries and your last try. You can't do that. So all 3 exams should be passed within the same try, within the same try. Otherwise, you wouldn't be eligible to apply. The other thing that I get asked quite often is about the common general test. So you need to have a minimum of 30 marks in that in order to be eligible. And when it comes to the grades itself, you need to have a minimum of 2 C passes and an S for physics. So there will be biology, chemistry, and physics, 2 C's and 1 S. So having said that, it doesn't necessarily mean that if you have 2 C's and an S, you're going to be considered for a place at KDU. So those are minimum requirements to apply, but it doesn't mean that those grades are going to be getting a seat, because it doesn't. They won't be accepting any students with 2 C's and an S in the science stream. And that's due to competition mostly, because most of the people that apply have a Z-score between 1.6 and 1.8 or above. So that's the equivalent of 2 A's and a B, or 3 A's. So that's the sort of grades that you're supposed to have in order to be selected. So it doesn't necessarily mean that you have 2 C's and S, you're going to be considered. Okay, so you have to keep that in mind. It's all about competition. That's a question that a lot of people keep asking. So you have to keep in mind that if you don't have a score between 1.6 to 1.8, most likely you're not going to be considered. Depending from the year of application, things can vary, because the number of application every year is different. In the 2 years ago when this started for local students, there were about 800, 900 applications, and there were Z-score ranging from 0.4 all the way to 1.8 and above. And last year it has changed. There were much lower, the number of applications was much lower. I think it was about 200 to 300. So the competition obviously has reduced since the first year. So obviously we have to see what's going to happen this year. But keep that in mind. If you don't have a score between 1.6, 1.8, maybe the chances of you getting considered for the degree are much lower. Sometimes even 1.4 and above can be considered. That's what we've seen last year as well. But yeah, the reality is that if you have a Z-score between 1.6 to 1.8, that gives you a really good chance of being considered to study medicine. Right, so with that said, there are a few more things that we need to consider in your application. Now, there are a few other things that need to be, that would decide whether you're eligible to apply to study medicine at KDU. And one thing is money. So this obviously is a paid course, so it doesn't matter if you, even if you have a Z-score 1.8, you have excellent academic performances and the rest of application is amazing, it doesn't necessarily mean that you're going to be accepted if you don't have the possibility to pay for the course. So that's also part of the eligibility criteria. You need to be able to pay for the course. And so we have seen a rise in the amount that you need to pay for this course. 2 years ago in Intake 41, when this started for local students, it was 12.5 million. Last year it increased to 15 million. This year 17.5 million, which will need to be paid across the 5 years that you're going to be studying here. And so when it comes to payment, they have their own payment schedule. You can see that on the website itself on how you're supposed to be paying for this course. And usually what they do at the start of every single year, you'll have to pay that full amount for that particular year. So as far as I remember, I can find it right now on the website, but it was about 1.75 million rupees for every single year that you're going to be studying. And the first year is a little bit above that, is about 3 million. And that has to be paid in one installment at the beginning of each year. So let's say that you're in first year, now you're going to second year. Towards the end of the first year, you need to pay in full for the second year. So that would mean 1.75 million going for the next year, paid in full. So you can't do installments where you're going to be paying a certain amount at the end of first year and then another installment in the middle of second year. Sometimes they might allow that, so there are certain obviously personal circumstances that can be taken into consideration. Obviously that's the part of up to the university to decide whether to do that or not, but most likely most of the times students have to pay in full for that particular year towards the end of the previous year. Right, so that means that when you're sending your application, they'll be looking at your ability to pay. So they'll be looking at this bank statements of your parents, or if you have any savings, anything like that that can help towards your application and showing to the university that you have the ability to pay for the 5 years. If you don't have that, obviously that means maybe your chances of getting in or being considered are much lower than someone obviously who has the capacity to pay for the degree. And so even if you have a 1.8, let's say a Z-score of 1.8 and there's another student with Z-score 1.5, it doesn't matter even if your Z-score is much higher, if you don't have the possibility to pay, the financial ability to pay, then the student with a 1.5 will be selected instead of the student with a Z-score 1.8. So I hope that makes sense. Okay, so right, so with that said, okay, So the thing that you have to understand is the Z score in itself is not going to give you a seat to study medicine. There are other things that will be coming across while after you apply to KDU. The first thing obviously is the Z score. After that, once they screen you based on a Z score, you'll have to do a series of tests, aptitude test. There are 3 tests. There's an English proficiency test, an IQ test of general knowledge, and a psychometric assessment. So you'll be finding past papers on the KD website. Right now, they're not there on the website, but you'll be able to find those later on as the first, as they screen the patients through the first round based on the Z score. They'll release those papers for you guys to practice, and they'll give a date for the test. So when they'll be carrying out the test at the university. So you'll be able to practice those papers, and then they'll be screening you based on those marks that you achieved there. And then the final step will be an interview for the shortlisted candidates, where the vice chancellor, the dean of the Faculty of Medicine, the registrar KDU will be there, and there will be some more invitees from the Sri Lankan Medical Council and from UGC, so from the University Grants Commission as well. And so the overall, when we look at the overall picture, your examinations, so your Z scores, your A-level examinations count up to 90% of your overall score. And then with that, there will be also sports and leadership achievements. So if you have any recognitions or achievements that you have been able to achieve over the years, over your schooling period, those will be considered up to 10% of your overall mark. And then obviously your tests and your interview will play a big role on your selection process. So keep in mind, it's not just the Z score in itself. You have to pass these other tests that the university is assessing you on in order to be selected to study medicine. So that's a question that gets asked quite a lot. Okay, so keep that in mind. And usually in the interview, they ask about your eligibility criteria, whether you have the ability to pay, and things are changing. So year after year, so new things are being implemented. So I cannot tell you exactly what's going to be asked in that interview. So that's something that you'll have to find yourself when you go there. But obviously there are certain things that you could do in order to prepare yourself. The most popular questions that usually get asked at a medical interview would be, why do you want to study medicine? Whether you're first person to go to university in your family, do you have any doctors in your family, why do you want to become a doctor, do you have any skills, interpersonal skills, or any sort of experience that has led you to study medicine or wanting to become a doctor. So these are the sort of questions that you can prepare yourself to answer if they get asked on your interview. And there are tons of different websites online that can prepare you to answer these sort of questions. So obviously make sure that it's the answers for these questions are true to yourself. It's not something that you just learned by heart and you're just regurgitating in front of the panel of interviewers, because obviously that gets noticed. So originality is very important. Okay, so keep that in mind. Right, so okay, so those are usually the general requirements that are needed in order to apply and to be considered for KDU. Now, having said that, there are a few things that get commonly asked. Again, it's about the structure of the course. So keep in mind that this is a 5-year course. So again, when it comes to finances, you have to make sure that you have the ability to pay for the full 5 years and not just for the first year or so, because that's important when it comes to consider whether student A or student B are going to be selected. Okay, so if student A and student B both have similar Z scores and they've done really well on their interviews and their tests, the financial ability to pay can play a role of what students should be considered. Okay, so keep in mind that those financial requirements are very important, and if you want to have a really strong application, make sure that you show as much as you can, as much of your savings that you and your family might have, in order to provide a much more rigorous and more stronger application. Okay, so now in terms of the course, obviously, like I said, it's 5 years. Your first 2 years are going to be at the Ratmalana campus, where you're going to be studying three subjects: biochemistry, physiology, and anatomy. And obviously, anatomy then breaks down into gross anatomy, clinical anatomy. There is histology and embryology with genetics components as well. And then at the end of the second year, we have a what we call second MB, which is a barrier exam. You need to be able to pass that exam in order to proceed forward towards the clinical years. So if you don't pass those three exams by the end of second year, most likely you're going to be relegated. So you'll have to pay additionally for the second year in order to be able to retake those exams the next following year. So every year you get 4 attempts for the second MB, 2 attempts during the second year, and if you're not able to pass by the second attempt, then you're going to be relegated, where you have to do the second year again, and you get another 2 chances to sit that exam. So if you don't pass the second MB by those 4 chances given, then you'll have to be they'll basically expel you from the course, and they give you the chance to study a different course at the university, or otherwise you'll have to leave the university and go somewhere else to study either medicine or a different course. And then let's say that you pass second MB, you're going to be moving towards third year. So the clinical years, third year, fourth year, and fifth year, the clinical years. And we have the third MB exam, part 1 and part 2. Part 1 is towards the end of third year, which is going to be in microbiology and parasitology. In fourth year, you're going to be part 2, which is pharmacology, pathology, forensic medicine, and community medicine. And then from there you move towards fifth year, which is based on 5 subjects. We have medicine, surgery, gyn and obs, psychiatry, and pediatrics. So during those 3 years, clinical years, you're going to be moving from hospital to hospital. It could be around Colombo, it could be outside of Colombo, depending on the appointment that you're supposed to have. Sometimes you can go all the way to Horone or Kalutere, Avisavelle, or it can be around Colombo, where you go to the National Hospital of Sri Lanka or the military hospitals, and sometimes also at our hospital in Burlesgamur, KDU, University Hospital of KDU, where you'll be doing some of the short appointments like hematology and so on. And then 50 years going to be at KDU. So 50 years, basically 10 months, 2 months for each subject. And then you'll be given a short study leave period of about 6 weeks in order to prepare for the final exams. So that's where I am right now. I'm in my study leave period, and then towards the end of August, September, that I'll be sitting for my final exams. So that's a just short overview, the structure of the course at KDU, which is very similar to any other medical course here in Sri Lanka. So there's not much difference there. And another question is regarding the possibility to do the internship in Sri Lanka. So you can do that. Once you graduate from the course, you'll basically be able to select hospitals where you want to go and do your internship for those 12 months. It's going to be divided into two slots of 6 months, where one has to be in medicine, so either medicine or pediatrics, and the other 6 months in surgery. So we have surgery as an option, and general obs. So one thing that has to be said here is that we are not going to be doing the common paper, which is the paper that every medical student within the country is doing. So all the government universities do this common paper in order to select their internship, but we are excluded from that for the moment being. So that means in the overall ranking, when they are positioning students for the internship, we have all the government universities first. So all the medical students within those government universities are going to be selected for the internships, and then after everyone else, there will be KDU. And after KDU, every other people, international medical graduate coming from outside, will be ranked for internships among the hospital within Sri Lanka. So the chances of us to remain in Colombo are obviously much slimmer. So all the students within the government setting have a much higher chance of nailing a internship within Colombo. Everyone else obviously might have to move outside. So having said that, if there are a lot of people obviously coming from rural areas, even within the government setting, so they might want to be going back to their own place, to their own villages or towns. So that means sometimes there might be some slots around the Colombo area. So that doesn't necessarily mean that we'll be moving within the rural areas of Sri Lanka. So there's still a possibility that we might end up in Colombo. So obviously that's is based on luck, and that's something that has to be looked at that particular moment in time. So that's not something that we can decide right now, even before starting the course, right? So just keep that in mind. Okay, so those are the general requirements needed to apply KDU. So I meant to talk to you guys a little bit about the course as well, the financial views, and also about the marks and the interview process. So those are things that need to be considered. Obviously, if you guys have any questions, feel free to drop a message directly to me on Instagram or on YouTube. I'll make sure to answer those questions as soon as possible. So with that said, I'll leave this live video for the moment being. And like I said, if you have any questions, feel free to contact me at any time. And I'll see you guys in the next video.